Okay, I'm Savannah and we'll be doing the valgus stress test. So you'll have the patient lift their arm up like this. You'll have one hand on the wrist, the other hand putting a valgus force on the MCL, or also known as the UCL, and you're testing for laxity. So you'll test bilaterally. Okay, I'm Savannah and we'll be doing the varus stress test. So you'll have the patient bring up their arm, have one hand stabilizing the wrist, the other hand on the medial side of the elbow, and you'll be putting a varus stress on the elbow. And you're looking for laxity, so you'll test it bilaterally, and you're looking at the LCL.
Hi, I'm Colin, and this is the passive lateral epicondylopathy test. So what we are looking for here is lateral epicondylitis or tendinopathy. So what we're going to do, if it is in this right wrist, the right lateral epicondylitis, what we are going to do, we are going to passively flex the wrist of the patient, and if there is pain, then that is a positive sign. Hi, my name is Colin, and this is the active lateral epicondylopathy test. And again, we are also looking for the lateral epicondylitis or tendinopathy. And for this one, what we're going to do, we are going to have the patient actively extend their wrist against my hand. And if there is pain if there's pain near the lateral epicondyle, that is a positive sign.
I'm Sheridan, and this is the passive medial epicondylopathy test, and we are looking at the medial for medial epicondylitis or tendinopathy. And so you're going to bring your patient's wrist into passive extension, and then if there's any pain, that's a positive test. I'm Sheridan, and this is the active medial epicondylopathy test, and we're looking at the we're looking for medial epicondylitis or tendinopathy. And what you're going to do is you're going to have your patient's arm up, and you're going to tell them to flex the wrist, and you're going to resist the motion. And if there's pain, that's a positive test.
Okay, I'm Savannah and we'll be doing the elbow flexion test. So you'll have the patient bring their arms up, have their wrists extended, and then you'll have them hold this for 3 to 5 minutes. And if there is any paresthesia, then that is a positive test, and you're looking for ulnar nerve entrapment.
Hi, I'm Colin, and this is the radial ulnar collateral stress test, and we'll be looking for RCL and a UCL sprain. So what we will do, we're going to bring their arm and wrist like this, and we are first going to test the UCL by putting a valgus stress, by going like that. And then we're going to do a varus stress to test the RCL like that. And if there's pain and laxity, then that is a positive test.
I'm Sheridan, this is the Feynman's test, and it's looking for carpal tunnel syndrome. And so what you're going to do is you're going to have your patient put their hands together like this, and then drop their elbows down, and then they're going to hold that for a minute, and then you're looking for paresthesia.
Okay, I'm Savannah and we'll be doing the Finkelstein's test, and you're looking for de Quervain syndrome. So you'll have the patient put their thumb in their palm, fold the fingers over, and ulnar deviate, and so rotate it forward. And if a positive test is a pre-production of signs and symptoms.
Hi, I'm Colin, and this is the varus and valgus stress test, and we're going to be looking at the medial and lateral collateral ligaments of the finger. And first, to test the medial collateral ligament, we're going to provide a valgus stress, and for the lateral collateral ligament, we're going to put a varus stress, and we are testing for what a positive sign is laxity.
Okay, I'm Sheridan, and this is the trigger finger test, and it is looking for flexor tenosynovitis. And what you're going to do is you're going to have your patient pull out their hand, and they're going to individually flex one finger at a time and then extend that finger. And then what you're looking for is a painful nodule or finger lock, and that's a positive.